So is there any other way with which we can differentiate if it is a disc issue or a sacroiliac issue? Say if one of you is anxious about doing an MRI, there is a clinical test where under live X-ray imaging, we can inject local anesthesia into the sacroiliac joints. Under X-ray vision, when you see the sacroiliac joints and you inject it right and the pain disappears, more or less clinically you know that the pain is rising from the sacroiliac joint. Because if the pain is from the disc, injecting local anesthesia in the sacroiliac joints will not help and the pain will persist. This is a clinical test done sometimes even now. I do it even now if my patients are anxious about an MRI scan. Treatment options, I would advise you to rest if you have an episode, ice it and heat it, alternate heat and ice. If the area is warm, ice it. Once you ice and it becomes really cold, heat it up. Because alternating heat and ice increases the blood circulation in that area. When there is blood circulation, there is healing. Over-the-counter painkillers, massage balms, local applications. I, for one, do not advise over-the-counter painkillers because there are few organs which you can replace. Your knee you can replace, your hip you can replace, but your kidney and your liver you just cannot replace. Yes, there are transplants, but the success rate and the stress you have to go through is very high. So do not abuse analgesics. All analgesics metabolize through the liver or through the kidney and they require a lot of enzymes for them to work. So every time you take an analgesic, you put stress on your liver. So the more stress on your liver, when it is already in stress because your body is in pain, is not good. So as far as possible, use physical methods of pain relief and ask your doctor if you need pain meds. Please do not abuse them as they are available easily. So now coming to the interventional treatment, say if you're on medication, physiotherapy, exercises, nothing helps. What can you do? We can inject platelet-rich plasma or mesenchymal stem cells. Basically, platelet-rich plasma or PRP is your blood harvested and concentrated into healing and growth factors, basically anti-inflammatory factors, and it is injected and under ultrasound guidance. I see the joint under both ultrasound and X-ray vision and I inject it right in the area of the SI joint and the success rates are very good. There is no scar, no incision, and it is also done under local anesthesia as a day care procedure. Advantage with injecting stem cells or PRP is that it is your own body's cells. We do not use any other pharmaceuticals inside the joint. So I believe that if you can naturally reduce inflammation using your own blood products, you are not altering anatomy. It is concentrating your healing factors and injecting it in a region of pain and inflammation to reduce inflammation. So it is the most natural way we can combat any inflammation in the body, and this principle applies to a lot of issues. We can also do implantation of electromagnetic devices which numb the nerves in the sacroiliac joint. I am not a big fan of that. I believe that regenerative orthopedics is the future and that we should use stem cells especially for anti-inflammatory effects, as they do not give any side effects and the possibility of rejection is very less. Finally, if nothing works, we can fuse the joint. It is a major surgery, so I do not advise it. So I encourage you, wherever you are, to talk to your doctors about platelet-rich plasma or PRP. I know for a fact that doctors all over the world are doing it. You just have to find a doctor who understands it and knows how it will help you and why it will help you. And trust me, it is a solution for many of the problems we have created in our body because of our lack of activity and bad postural manners. So that was low back pain and sacroiliitis, how to differentiate it. I hope it was helpful. I thank Mrs. Senthil Satyabama who brought this interesting topic to my mind. Thank you very much. If any of you want me to talk about a bone, just comment, know your bones and the bone or the bone disease you want me to talk about, and I will be very happy to talk about it.